Hello, my name is Dr. Amador Flores Jr. I've been in practice for 22 years, the last 15 in private practice. I was born and raised in Laredo. I went to public schools throughout up until the time I went off to school. I went to the University of Houston, did my undergrad, got my bachelor's in physiological optics, then graduated from the University College of Optometry in 1995. My goal was always to come back to Laredo. I started off in the group practice in '95. Then about 5 years later, went into private practice, and I've been in private practice since. My dream was always to come back and serve the community. The question that I get often asked is, why optometry? And it's really hard to pinpoint. Optometry, I've always been fascinated with the eyes since early childhood, but it probably wasn't until I was about maybe 7th or 8th grade when I got my first pair of glasses and realized what I was missing out in the world. And so it was always fascinating to me how, at that point, how glasses would correct one's vision and certainly clear things immensely. Later on, I realized that optometry is not just about vision and glasses, but it's really about the whole organ and from the outside of the eye to the inside of the eye, and how it plays a vital role in your senses, knowing that vision really makes about 80% of your sensory input. And coming back to Laredo, you get to deal with all patients of all kinds, all ages. And so over the years, my practice has grown from not just a pediatric practice, but also to a geriatric practice. And in an area where you see a lot of pathology, whether it's hypertension, diabetes, you get to see these patients and treat these patients accordingly, and ultimately in an effort to save their vision. Well, the most surprising thing in optometry was, once I graduated and came back down, especially in an area like Laredo, realizing that there's so much pathology out there, and patients, unfortunately, either because of lack of education or social economic reasons, don't always take care of themselves. Patients know they're diabetic, but don't know, for example, that diabetes can affect the eyes. And as a matter of fact, diabetes is a leading cause of blindness in the United States, but it's also a leading cause of preventable blindness. And so in screening patients all day long, whether it's because it's diabetes or glaucoma or any type of circulatory disease, and being able to intervene and treat these patients and ultimately preserving their vision has really, in that sense, given me not only the surprise, but also the reward of being able to help others with their visual needs. One of the things that patients experience when they come and see me, I try to always keep up with technology, and that's important if you're going to practice full scope optometry, medical optometry, which basically means you're not just treating patients for glasses and contact lenses, but again involves all the other aspects of pathology. You need to have the equipment to do it. So oftentimes patients come in and they get that wow effect where they say, well, I've never done this before, I've never done that before. And that includes, retinal cameras and instruments that check peripheral vision, and instruments that check electrophysiology, and tools that you need to have if you're going to treat these kinds of patients. Oftentimes patients always compliment me on that. And also the mere fact that things are explained to them. We live in a day and age where a lot of times doctors, give you the 2 or 3 minutes and that's it, and they're gone to the next room. I try to afford every patient the time that they need. So a patient may take 20 minutes and the next guy may take an hour, but I always try to put myself in their shoes, where I do this all day long and I repeat myself 100 times a day. A lot of times patients, this is all new to them. So I try to put myself in their shoes and say, okay, how would I like to be treated? How would I like to have things explained to me? And ultimately, that's kind of recurrent compliment that I never get tired of hearing, and saying, you explain things very well. I learned from you. This is the first time I experience this. And that in itself for me is a great compliment and really keeps me going, and I'll never get tired of doing that. We invite you to come into our practice, come see us at our location, and whether it's for a simple pair of glasses or contact lenses, or someone who's in need of care for their diabetic needs or their glaucoma needs, or because they've been told they have some type of systemic disease and they got to get their eyes checked, come and visit us, and I'll be more than happy to see you and treat you accordingly.